Hello everyone, myself Vidya Jadhav, student of Shivajirao S. Sundar College of Pharmacy. Today I am going to explain transdermal drug delivery system. Transdermal drug delivery system. This is the content page. Definition: transdermal therapeutic are defined as self contained discrete dosage form which, when applied to the intact skin, deliver the drugs through the skin at a controlled rate to the systemic circulation. Or transdermal drug delivery system are systems that utilize skin as a site for continuous drug administration into the systemic circulation. Mechanism of drug absorption through skin. Epidermis. It includes stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, dermis, and subcutaneous. Pathway of drug absorption through the skin. First, transfollicular route. Transfollicular route is the shortest pathway that drug has to follow to reach the systemic circulation that provides a large area for diffusion of drug. B. Transcellular route. Drug delivering through this route passes from corneocytes which has highly hydrated keratin creating hydrophilic pathway. The drug passes through the corneocytes of stratum corneum. Third, intercellular route. In intercellular route pathway, the drug diffuses through the continuous lipid matrix present between these cells. Fundamental of skin permeation. Rate of permeation dq by dt across the skin can be expressed as dq by dt is equal to ps bracket cd minus cr, where dq by dt is equal to rate of permeation, ps is equal to permeability coefficient, cd is concentration in donor compartment and cr is concentration in receptor compartment. Factors affecting transdermal permeability. The principal transport mechanism across mammalian skin is by passive diffusion. The factors influencing and having differences in transdermal permeability of the stratum corneum. Lipid solubility. At higher concentration, the rate of penetration of the alcohol is greatly increased and does not follow the pattern of absorption from weak solution, but high concentration may damage the stratum corneum, impairing its barrier properties. Partition coefficient. Drug possessing both water and lipid solubility are favorably absorbed through the skin. Transdermal permeability coefficient shows a linear dependency on partition coefficient. A lipid water partition of 1 or greater is generally required for optimal transdermal permeability. pH condition. The extent of dissociation in case of ionic drugs and their transdermal permeability depends on pH conditions of the skin surface as well as the drug delivery system. In case of ephedrine and scopolamine, the transdermal flux of the drug increases with increasing pH up to 1.2 approximately. 1.2 higher than their respective pKa values. Permeation enhancers. These are compounds which promote skin permeability by altering the skin as a barrier to the flux of a desired penetrant. This may conveniently be classified below: solvents, surfactants, miscellaneous chemicals. Types. There are four main types of TDDS: single layer drug in adhesive, multi layer drug in adhesive, drug reservoir in adhesive, drug matrix in adhesive. Single layer drug in adhesive. Single layer drug in adhesive system is characterized by the inclusion of the drug directly within the skin contacting adhesive. In this transdermal system design, the adhesive not only serves to the affix the system to the skin but also serves as the formulation foundation containing the drug and all the excipients under a single packing film. The rate of release of drug from this type of system is dependent on the diffusion across the skin. Multilayer drug in adhesive. The multi-layer drug-in adhesive is similar to the single-layer drug-in adhesive in that the drug is incorporated directly into the adhesive. However, the multi-layer encompasses either the addition of a membrane between two distinct drug-in adhesive layer or the addition of multiple drug-in adhesive layer under a single backing film. Drug reservoir in adhesive. The reservoir transdermal system design is characterized by the inclusion of a liquid compartment containing a drug solution or suspension separated from the release linear by a semi-permeable membrane and adhesive. The adhesive component of the product responsible for skin adhesion can either be incorporated as a continuous layer between the membrane and the release liner or in a concentric configuration around the membrane. Drug matrix in adhesive. The matrix system design is characterized by the inclusion of a semi-solid matrix containing a drug solution or suspension which is in direct contact with the release linear. The component responsible for skin adhesion is incorporated in an overlay and forms a concentric configuration around a semi-solid matrix. Advantages: avoid of avoidance of significant pre-systemic metabolism and the need therefore a do, therefore a lower daily dose. Recent inter and intra-patient variability. Drug input can be terminated simply by removal of patch. Drug levels can be maintained in the systemic circulation within the therapeutic window for a prolonged period of time. Self administration is possible. Disadvantages: it is limited only to the potent drug molecule. Drug must not be locally irritating or sensitizing. Drug or drug formulation may cause skin irritation or sensitization. Drug with short biological half-lives that are subject to large first-pass metabolism. Conclusion: transdermal drug delivery technologies are becoming one of the fastest growing sectors within the pharmaceutical industry. Advance in drug delivery system having increasingly brought about rate control delivery with fewer side effects as well as increased efficacy and constant drug delivery. Thank you.